Hey everyone! Have you ever thought about what is inside your body when you are typing? I type all the time for assignments, emails, even gaming. Never really thought about what my hands are doing. Well, today we are going to explore the anatomy behind typing and how a condition called carpal tunnel syndrome occurs. And most importantly, how to prevent it. When you type, your fingers are moved quickly, but they are powered by muscles in your forearm, not just your hands.
Right, this muscle pulls on tendons that run through your wrist to help your fingers move.
And they all pass through a narrow space in your wrist called the carpal tunnel.
The carpal tunnel also contains the median nerve, which controls sensation and movement in the thumb, index, middle, and part of the ring finger.
So, it's a clouded space. If anything inside swells out, like the tendons or surrounding tissue, it can press on that nerve.
And that's when problems start. I've actually been feeling some tingling and numbness in my hand, mostly after typing for a while.
That sounds like early CTS. The median nerve is likely being compressed in your wrist.
It usually starts with the weird whizzing feeling, and sometimes I wake up with a numb hand.
The main symptoms include numbness or pain in your thumb, index, and middle finger. It can also lead to weakness and trouble gripping objects.
Honestly, I've dropped my phone for a few times. It's kind of embarrassing.
You're not alone. CTS is common in people who do a lot of repetitive hand movement like typing, using a mouse, gaming, or even factory work.
But it's not just overuse, right?
Exactly. Other risk factors include poor wrist posture, injuries, and medical conditions like arthritis and diabetes also may cause CTS.
And some people naturally have a smaller carpal tunnel, so they are more at risk even with light use.
If you catch CTS early, it can usually be treated without surgery.
I wear this splint at night. It keeps my wrist straight, which helps to relieve pressure on the nerve.
And if symptoms do not improve, doctors can run a test called EMG. It can check how well the median nerve is working.
In really serious cases, surgery might be needed to release the pressure in the carpal tunnel.
A wrist splint is one of the most effective and simple treatment for early-stage CTS. It works by keeping the wrist in a straight, neutral position, especially during sleep, when we tend to bend our wrist without realizing it. Bending the wrist decreases the space inside the carpal tunnel, which increases pressure on the median nerve and worsens symptoms. By holding the wrist steady, the splint reduces that pressure and allows the nerve to rest and recover. Many people find out that wearing a splint consistently, even just at night, can significantly reduce symptoms like tingling and numbness, and sometimes even prevent the condition from getting worse without the need for medication or surgery.
If symptoms continue or become more serious, doctors may use a test called electromyography or EMG to check how well the median nerve is functioning. EMG involves placing a small electrodes on the skin or into the muscle to measure how quickly and strongly your muscles react to the electrical signal sent through the nerve. This helps to detect whether the nerve is being compressed and how much it has been affected. EMG is often paired with a nerve conduction study, which measures the speed of the nerve signal. Together, these tests give doctors a clear picture of whether the symptoms are due to carpal tunnel syndrome or other condition. This can help to guide the best next steps in treatment, including whether surgery might be needed.
So, what can we all do to avoid the CTS?
Here are my top 3 tips. Keep your wrist straight while typing. Take breaks every 30 minutes. Use an ergonomic setup like keyboard, mouse, and chair.
Small changes can really protect your hands long term. Thanks for watching.
Stay safe
and take care of your wrist. Bye bye.